Hello, St. Mark's. It's April 8th, 2020, and I'd like to welcome you to another edition of St. Mark's Midweek Podcast, where we check in on the goings-on at St. Mark's Church. My name is Matt Wright, and I'm joined today, as I am each week, by our pastor, the Reverend Carri Patterson Grindon. Hi, Carri.
Hi, Matt.
And a little bit later, I'm going to be joined by St. Mark's Church member Bob Ross, who professionally is known as Dr. Robert K. Ross. He is the chairman of the California Endowment, Cal Endow, and they have a big public health footprint in California. He's going to talk with us about the coronavirus pandemic and what he's observed so far, what the challenges are, and I think you'll want to hear what he has to say. I think you'll come away heartened. So, before we do that, Carri, nice to see you.
Good to see you, Matt.
It's been a busy week at St. Mark's. What's going on?
We're just trying to continue to serve our community in all kinds of ways, and our community, as I've been telling everyone each week, are doing a good job of loving one another. We're doing that at a distance, and I don't know if anyone else has Zoom fatigue, but I sure do.
I do.
Well, yes, I was on a Zoom call with all the clergy of the diocese with our bishop, John Taylor, Bishop Bruce, our suffragan bishop, and Melissa McCarthy, not the actor, but the canon to the ordinary, recently. And I have to say, while it was fantastic to see so many of my colleagues' faces, I'm weary of seeing the people I love on a computer screen. Mm-hmm. The physical distancing, while critically important and the most loving thing we can do right now, is not the same as getting to be in a room with people you love. And so I miss everybody. I miss being together. So we keep on keeping on in that practice because it's what we need to do. But I just wanted to acknowledge my own yearning to be together in the way we're used to.
Yeah. Well, this leads me to an editorial I read on April 2nd in the LA Times. It's called "Religion During the Pandemic." And it's a fascinating editorial, and those of you who are listening now might want to look it up online and look at it as I did. It's basically an essay about the tension in religious communities, the tension between needing to distance socially and the desire to be together as a community. And we know from reading the news that there are religious communities in various parts of the country that are essentially flouting the order to socially distance. And celebrating, 500, 1,000, 3,000 at a time.
Right. Because
they see that as the essential practice of religion and a statement about their ability to worship and freedom to worship. We at St. Mark's have taken another tack. We've chosen another course. And I wonder if, I know you've thought deeply about this, but I wonder if you could share some of your thoughts about that tension and why St. Mark's has chosen this course and what that means to you, and whether that's really a true expression of our religious commitment and an example of how our community functions best.
Mm-hmm. I mean, obviously, the optimal thing in worship is to do it in real time in one place together. So I just, again, want to start by saying that it's difficult not to be able to do that. I've been thinking a lot about why is that so hard for us, and it's not unique to St. Mark's, though certainly it applies to us, but at the heart of our faith is this person, Jesus, who is God in flesh. And some of what we love most about the way God showed up in Jesus is he was a human being who moved around, who touched people to heal them, who fed them with his hands, who had intimate conversation face to face with people. So the optimal expression of who we are as the body of Christ is in person, in the flesh, reaching out to one another actually, and being together around a table in real space and time.
Yeah.
So it's hard not to do that for theological reasons and just for practical reasons. We love being together. But right now, there's no way for us to do that and to do it safely. And so what we've chosen, and the editorial points this out too, is churches mostly and responsibly, lovingly, faithfully are opting not to gather to favor those who are most vulnerable, which is clearly our call in the gospel. Jesus had a preference, a deeper advocacy for those who didn't have a voice, who were on the margins, who were the most vulnerable. And so the best way for us to follow Jesus is to act like he did in that way. And that is to take care of the ones who are the most vulnerable. And that's what we're doing. As hard as it is for us and as much as we miss one another, that's what we're doing by staying at home, by connecting in these really creative and in some ways really deep ways, and enduring the physical distance for the time being in preference of love for those who are vulnerable.
Yeah. Well, I think we're doing our best at St. Mark's to keep in contact with people and to keep church coming with the podcasts and in being in touch. I know you've sent church members out. We have a phone tree essentially.
Right.
People are calling other people. People are checking in.
That's right.
And I've heard some stories from in my own house from Mary Ann, my wife, who's calling people, and it lifts her spirits. And I hope it's doing the same for the people on the other end of the phone.
Yeah, I think the quality of conversation and the intimacy of conversation is even deeper than when we are all together. I'm doing those calls myself, and
it's focused more, isn't it?
It's focused. It's intimate. It's lengthy. You know, people are listening deeply to one another. Some of the people who are calling folks weekly were assigned to people they didn't know at all. And so they're building relationships across the different congregations, across, generational difference. And it's, I'm hearing back from some of these callers, like, I didn't know this guy. He's fantastic. I mean, they're just these deep connections and sort of surprise friendships happening.
Yeah.
And those aren't impossible on Sunday mornings, but this has provided a way to go deeper.
Yeah.
And so it's really binding us together. I just feel this sense that when we are able to be back together, we're going to know each other more deeply than we did before, and we're going to be even closer, truly.
Yeah.
So I just ask people to, when you feel that distance, when you're hurting, aching to just be with your friends in the flesh, at church or otherwise, pay attention to that feeling. And the story of that feeling is love. We ache to be with people because we love them. And we're going to get really good at noticing how much we love one another, And I mean, I think back to a long stretch of my early relationship with my husband, Al and I lived apart for the better part of a year before we were married. And, that the old adage, absence makes the heart grow fonder, is true. It's also just you realize how much you love someone.
Yeah.
When the love is already there, but you realize how much you love people.
You want to be with them.
Can't be with them. And so that's a beautiful thing, to notice how much we really love each other, and look forward to when we can be in the same room to express that. But in the meantime, we're expressing it through these phone calls, through our ministries, on the computer screen, and all these other ways. So grateful for that, and grateful for the love that is represented in that ache.
Yeah. Well, before we welcome Bob Ross to our podcast, I want to ask you about plans for Easter Sunday. We're in the middle of it's Wednesday of Holy Week.
Yes.
And here we are. And
yes.
I don't think any of us imagined at the beginning of 2020 that Holy Week was going to resemble anything like this.
No.
But we've made plans. We'll have Easter Sunday service for St. Mark's Church on air, and we're working on that. And I think that should be something that everyone enjoys, and I hope it brings comfort and some strength to people. What are our plans for the rest of Holy Week?
So starting tomorrow, we are putting together a Zoom recording. So for Maundy Thursday, that's our typical Maundy Thursday service would happen in the community hall. There would be a feast, a sort of agape feast, and then we would go into the church for the Eucharist. So we're not doing that this year for all the right and obvious reasons. But what we are creating is a Zoom recording. So a collection, a kind of wide collection of St. Mark's members will have a simple worship service on Zoom. It'll look a little like the Brady Bunch. There'll be 9 squares.
all the squares.
Yes.
The windows.
So there'll be 9. So that's for the young people in the listening audience. You won't know what I'm talking about, but many of us will understand. So 9 squares. Each square will have members of different households from St. Mark's, and they'll be leading us in prayers and some beautiful music, some readings, including the reading of Jesus with his disciples washing their feet. So you can look forward to that. It will be a recording, so you can watch it when it works for you.
Okay.
But we're going to encourage people to watch it together at 7:00 in the evening if they're able.
Okay.
So we can have this sense that we're all having this communal
It's all together.
experience at the same time. Exactly. So that, and then on Good Friday, Mother Betsy is putting a lot of resources up on our website. So you always go to the website to look for these things. But on the website, she'll be pointing us to some larger church Good Friday celebrations, Good Friday liturgies around the diocese and the national church. And so we can participate in that way. I believe we're also putting together some music that will be up on our YouTube channel, music from St. Mark's, musicians like Mark Robeson, David Key. So that will just be a meditative music tool for your contemplative celebration or remembrance of Good Friday. On Holy Saturday in the morning, our EFM group, who have been bringing us morning prayer all the way through the season of Lent, are going to host a Zoom call. All will have access to that. That'll be in real time, and it will just be a gentle, Holy Saturday morning opportunity to gather, to pray, and talk a little bit about what it is to be living in this time. And then, as you mentioned, Easter morning, we're going to do our St. Mark's Church on Air podcast with glorious music from our organist, beautiful readings, and I get to be preaching that morning. So I'm really looking forward to that. So that's what we've got going on. And then, as I mentioned last week, we're going to celebrate Easter again when we don't have to physical distance anymore, and we'll do that whenever is the best time to do that.
Yeah. Well, there's a lot to look forward to, even in this time of challenge.
Absolutely.
And it's amazing how the church adapts to the times.
Yeah, it is. And I'm just eternally grateful for the way our people continue to serve and love one another. I can't say it enough. And especially grateful, Matt, to you, your family for opening your home for these recordings, but also just all the incredible work you and your team are doing to keep us connected through this podcast.
Thank you. We have a good team.
Fantastic.
Some veterans and some young talent. And the people have really pulled together to help make church happen for our community. Reverend Carri Patterson Grindon, thank you for being with us, and we'll talk again next week.
Can't wait. Thanks, Matt.
Right now, I want to introduce you to a man that many of you actually already know, but I don't know that you know exactly what he does in his life outside of Sundays at St. Mark's Church. So please meet Dr. Robert K. Ross. Bob, good to see you.
Good afternoon, Matt. Thanks for having me.
Bob is the president and chief executive officer of the California Endowment, which is a private statewide foundation started in 1996 to address the health needs of Californians. And before he joined the endowment in 2000, he served as director of the Health and Human Services Agency for the County of San Diego. He has an extensive background in health philanthropy and as a public health administrator and clinician. He served as a commissioner for the Philadelphia Department of Public Health, medical director for Link school-based clinic program in Camden, New Jersey, and instructor of clinical medicine at Children's Hospital of Philadelphia, and as a faculty member at San Diego State University School of Public Health. He got his MD, MPA, and bachelor's degree from the University of Pennsylvania. You're a Penn man through and through then.
I'm a Philly guy. Cheesesteaks. I know cheesesteaks.
Before we get down to the hard stuff, what brought you to California? Did you come to California to go to work in San Diego?
Yeah, I was at the time, which was the early 90s, mid-90s. I was in my position as Commissioner of Public Health in Philadelphia.
Okay.
And I was recruited by San Diego County to come out and run their Department of Public Health. And I was at a moment in my life where a move was welcome, a change of scenery was welcome. I had never had the California experience.
Okay.
I thought I'd come to San Diego and do that job for 3 or 4 years and head right back to the East Coast after getting my fill of Southern California, and 30 years later, I'm still here.
What brought you to St. Mark's? How did you find St. Mark's, or how did St. Mark's find you?
Robin and I had been attending All Saints Church, and we just wanted a more intimate experience. Robin found St. Mark's, and I can't remember who she heard from about it, and I really attended just with the intent of finding a place that I could feel comfortable in, sitting in the back row, putting a few bucks in the basket when it came around,
Right.
and that would be, more or less the extent of my spiritual experience. I felt
Right.
like I needed church, but my day job, Matt, is really pretty social by nature.
Yeah.
Which is odd because I'm actually an introvert. When I do those personality battery tests, I always score very high as an introvert.
You like to be by yourself.
I do. And so I really came to St. Mark's just for that reflective, introspective, spiritual experience. And lo and behold, I found this beautiful community.
Yeah, and I see a lot of you at church, so it must have really taken hold.
It did stick. In fact, when Robin and I when we first joined St. Mark's after about a year, and beginning to fall in love with it, was when the minister up and retired, and I remember feeling thrown for a loop by that decision. I'm blanking now on the pastor's name when we joined.
Colville.
Colville.
Yeah, Colville
was
Smith.
wonderful. And then went through the, just patiently sat through the process of St. Mark's. It's
Right.
selecting a new leader. That was interesting just to watch the Episcopal Church do anything, which is by
Right.
a lot of democracy and
Right.
a lot of inclusion, and you got to be patient. And if you don't like trusting processes, it's not for you. And lo and behold, we found one Carri Patterson Grindon, and
We've never looked back. have
never
we?
looked back.
Well, I'm sure glad you're part of our community. I think it's made a big difference to all of us, and I know everybody I know would say the same thing. So
Absolutely.
Thank you, man.
I'm glad to hear it's made a difference to you and your family too.
It's been two-way. We've gotten a lot of joy out of it.
I want to talk a little bit about your day job here, and really talk to you, frankly, if I can, about what we're going through now, just in terms of COVID-19, the effect on public health, the effect on our communities, the effect on the St. Mark's community. And I'd like to just start by asking you a really basic question. What separates COVID-19 from the seasonal flu? We've heard coronavirus compared to the seasonal flu. Yeah. And can you explain to people why there's a difference?
Yeah, it's called the novel coronavirus for a reason. It is new to human health, although it's been in existence in the animal world. But it has behaved unlike any other viral foe or enemy that we've encountered in probably the last century. It's sneaky, nasty, evil in a number of ways that we're learning more and more about each week. It is as or more infectious than influenza. It has a higher mortality rate, meaning more death as a result, compared side by side to influenza. It appears to be transmitted in ways that beat and defy traditional norms of flu-like illnesses. There are people, stories now, one that I know struck for those of you that follow the news at St. Mark's, was a particularly jarring story of that church choir in
Seattle.
Washington State, where I forget how large the size of the choir was, but at least a third of the choir members came down with the virus, and two of them, I believe, passed away. Yeah. None of them sick, coughing, or with fever or sneezing at the time.
Right.
So this notion that you can be asymptomatic and still spread the disease is pretty, that's new, that's novel for us, and has defied the transmissibility and viral spread bar that even influenza, polio, tuberculosis, I mean, you name it, this is a disease that has pretty much beaten the pants from a viral spread standpoint of anything we've ever seen in public health.
You've talked and written about flattening the curve, and it's become a familiar term to us now. It was a new term to me 3 weeks ago. Yeah. Would you explain more fully what that means and tell us whether you see evidence that it's working in California or elsewhere? Yeah, so there are a lot of things about this. If I come back up for a second, there are a lot of things that are jolting and jarring about this virus, and I just explained one of them, which is its level of transmissibility. But there are some things that we can control, and the things that we can control, we should do the best we can to do that. And social distancing, which I prefer to call physical distancing, is among them. And the reason why physical distancing is so critical is because you want to try and dampen the rate of rise of the spread of the virus. And the reason why you want to dampen it out, or what's called flattening that curve, the upside of the curve, meaning the number of new cases of a viral contamination or viral spread,
The reason why you want to spread it out over time is because our health system is built to take only so much illness. There are only, as we're learning now, there are only so many hospitals and so many hospital beds and so many ventilators and so many doctors and nurses and hospital staff. And so the reason for flattening the curve is just to spread out that illness, requiring that kind of intervention over a longer period of time and not overwhelming the hospital system as we've seen in Italy already. And as we've begun to see this past week in New York City, where you have these horror tales of people, of physicians literally running out of ventilators to treat people with the respiratory illness. So social distancing, physical distancing, again, the term I prefer, that's something that we can control. Evidence from this past week, certainly here in California and nationally, that physical distancing is working. That it's beginning to dampen the new number of cases of people with fever or people being admitted to hospitals. And so we're at this moment right now where we think and we hope we're just getting into the worst part of the epidemic.
Yeah.
But at the same time, some evidence that physical distancing is working. So this is the absolutely clear, critical moment where physical distancing needs to be practiced, needs to be affirmed. We know the kids are getting cabin fever and going nuts. Right. We know you miss your families and you're tempted maybe to have that dinner party. Don't do it now. Hang in there. Give it another month, and hopefully the worst of it will begin to get behind us.
Yeah. We all look at the news, and it's kind of, I hate to put it in crass terms, but it's kind of like a car accident or a disaster on television. You hate to see it, but you can't look away. And the news has pulled a lot of us in. And I just find myself being whipsawed between stories of hope and 5 minutes later, stories of utter desperation. And it's very hard for me to reconcile the two. And I find my head feels like it's ready to explode. And my question for you is, can you give us in all of this a sense of perspective? How do we look at the news, and how do we interpret what we see? Is there a way that you suggest that if we need to look at the news because we need to stay informed, that we learn how to interpret what we're seeing and find a balance between the horrible and the hopeful?
Well, as we all know, even before COVID-19, we always know what the news does, right?
Right.
It follows car chases and as the saying goes, you know this well from your experience, Matt, in the media. If it bleeds, it leads. Yeah. That's the story in the news. So we're getting that on steroids and in triplicate right now. When I was in public health, running a public health department, we used to say that, we never had an interview request when we were successfully controlling disease, right? That's not a news story.
That's right.
But if there's a food poisoning outbreak at a local hamburger restaurant, they're going to be knocking on the door. So that sort of just comes with the territory. Number one. Number two, keep in mind, pandemics do end. They have a beginning, they have a middle, and they have an end. And we will get through this, and it will end. And so that leads you to, okay, this thing is going to get behind us. How do I keep myself safe, my family safe, and how do we get through this until this thing comes to an end? And the optimistic part of me says, here's what may work in our favor, that could very well work in our favor, that gets it to end more quickly, or at least be ameliorated more quickly. One is, again, social distancing, physical distancing to flatten that curve. Make sure our health system's not overwhelmed, number one. Number two, can we stretch out the flattening of that curve into the warm weather months? May, June in particular, the summer months. Experts are hoping and betting that the coronavirus, even though it's a new virus, will behave much like the flu, which has a natural tendency to just sort of drop off or even disappear in the summer months, right? So if we're fortunate, we'll get a break. I may not go away completely, but we'll get a break as we get into warmer months. So flattening that curve, just circle June 1 on your calendar, and get you and your family safe
Get there
for June 1, and then let's see what happens. Yeah. And then the third thing I'm crossing my fingers about is the ingenuity and creativity of our healthcare system. We were poorly prepared for a pandemic. Yeah. We know that from a governmental standpoint. But we've got some of the smartest and best research minds in the world right here in this nation. And we need either a vaccine or a treatment, preferably by this winter. And if we can get a vaccine or a treatment by this winter, or at least something that has some degree of success, then we will have decided that, okay, this is what we're dealing with now is in fact the worst of it. We may have to live with coronavirus for a couple of years. But if we're going through the worst of it, if people know right now that this is going to be the worst of it, they can suck it up.
Right.
They can hang here.
You can take it if you know there's an end.
They can take it if you know there's an end. So that's what keeps me going and positive. And then, of course, lastly, which I'm sure we'll get to in this conversation, what are the lessons for us as a society that we can apply?
Right. What do we do going forward?
Not only just to protect the nation from future pandemics, but how do we come out of this as a stronger nation and a stronger community?
Yeah. I want to end on an up note. You had a big success here just before this storm broke over our heads with the Care First Jails Last program, and you were chair of a task force that went to look and see what. You could clarify for me, but basically look at incarceration in LA County and to assess what effect it was having on the jail population and on the mentally ill. And you could probably describe this with greater sophistication than I can, but it was very well received by the county supervisors who decided to implement the program.
Yeah.
And maybe you could tell us a little bit about your work with that task force and what you're looking forward to in the future in terms of mental health care and jail incarceration in LA County.
Justice reform, sure.
Justice reform.
Yeah, and the two issues, Matt, the COVID-19 pandemic and the need for justice reform and jail reforms, and they're related in my view. The one thing we've learned as a health foundation is we try to take more of a community orientation to health rather than an individual orientation to health. And that's different than how our healthcare system is structured, right? It's primarily structured as sort of a doctor-patient, health insurance, family kind of relationship. We really do take a community view. And it's because of that community view that we were convinced by community leaders across the state of California whose communities have been disproportionately negatively impacted by over-incarceration and hyper-incarceration. So incarceration, the incarceration phenomenon in this country is a system that by and large criminalizes poor health. Mm-hmm. It criminalizes the lack of health and wellness. Mental health, as you mentioned, emotional health, social emotional health. And as a result, we have a health delivery system that has decided that people who have committed crimes and have made mistakes and have hurt other people in the community through a lack of good mental health, through addiction, through other kinds of behavioral health conditions, that it is better for us to incarcerate them than to find meaningful ways to treat them, right? And that's an issue of, back to the COVID-19 epidemic, that's a question on a matter of belonging. It's a very existential, spiritual question for our nation about who belongs and who doesn't, and who is an American, and who is worthy of our care and support, and who isn't. And those questions have, in addition, a racial lens and a racial equity kind of lens to it, and that black and brown people are just disproportionately over-incarcerated. So what we just try to do with the report is to say, you know what, if we flip this thing on its head, and we said instead of having jail as the first resort, we're going to make jail the last resort, and put care and support and services, quite frankly, love first.
Right.
Everywhere that these people show up in the system, what would that look like? How might it be different? And so we were invited to go down that path, and that's basically the plan that we gave to the county Board of Supervisors. And it looks at 6 or 7 points in the justice system where someone shows up at a moment where they could be criminalized and punished, and instead are offered care, services, support, job training, supportive housing, mental health services, of course, drug treatment services. And if you could do that with a sense of discipline and intentionality and assertiveness, you really could substantially reduce the jail population, which quite frankly is also a taxpayer benefit.
Yeah.
Because having someone in jail is pretty expensive. A juvenile in jail right now costs the taxpayers about $220,000 per young person who's in jail. And think of the amount of services and job training. Yeah. That's 5 years of college at Harvard.
Right.
4 years if you can get out faster. So that's what the work was about. It was a joy to do, and it was a joy to lead that project. But it really does, back to my Sunday mornings at St. Mark's. Belonging is not only a very powerful spiritual tool, it makes us healthier too.
Yeah. Bob Ross, thank you.
Thank you
for being with us, and
thank you for all that you do at St. Mark's.
Well, no thanks necessary. It is part of a great community, and I really look forward to being back under that roof on Altadena Drive with all of you as soon as it's appropriate to do so. But I'm really glad that we could speak and talk, and I'm glad people get to hear a little bit more about your work and more of your story.
Thank you so much, Matt.
Thanks for joining us today for St. Mark's at Midweek. Thanks to Pastor Carri and our special guest, Dr. Bob Ross. Our associate producers are podcast administrator Lucy Grindon and technical director Emily Wright, with special thanks to Marianne Wright. Join us this Sunday for a special Easter edition of St. Mark's Church on Air, and again next Wednesday for St. Mark's at Midweek. Stay healthy, look after each other, and God bless you till we meet again.